In this record year for wildfires, smoke is blanketing more states than ever before. And there's just been an emergency link between all of that smoke and rising cases of COVID. Alexa Liaco's in one community where people are helping families recover from COVID without having to go outside.
This is the fourth year in a row of major wildfires.
It's Mother Nature doing what she does.
Raging flames, thick smoke, communities left to rebuild.
It's more than just the fire itself, it's the memory of the previous fire, and so many people are really on edge.
2020 was a record-breaking fire season, but this year is on track to be even worse. In California's wine country, the glass fire in 2020 wiped out more than 1,000 homes and burned 67,000 acres.
The sun would come up orange for days.
But families here weren't only worried about losing their homes.
2020, we served almost 2,000 people with COVID.
The pandemic ripped through this community at the same time. But Food for Thought was there to help.
The fact that we're bringing all these nutritious foods to our COVID clients, I think, is contributing to their ability to heal.
This food bank delivers healthy food to medically vulnerable people. It was founded in 1988.
In the middle of an epidemic, the AIDS epidemic, there were people that were suffering and didn't have enough food.
This prepared Executive Director Ron Karp to deal with long-lasting emergencies. And now the need is greater than ever.
Things really shifted when Delta came. We've already served 2,500 people with COVID.
Ron is worried as he watches COVID cases climb again. The smoke in the air is only making his community sicker and his job tougher.
It certainly has exacerbated people's problems with COVID because the smoke is really bad for the lungs, and COVID is a disease that affects the lungs. So I think more people are dying because of that.
Researchers at Harvard found that is true. They studied almost 100 counties across Washington, Oregon, and California and found 20% of COVID cases last year were linked to elevated wildfire smoke. That means nearly 20,000 COVID cases and 750 COVID deaths were attributable to smoke. Harold DeWitt was grateful he survived his breakthrough case.
They said that if I hadn't had the vaccine, there was a possibility, that I would not have been in very good shape.
He has diabetes and Parkinson's.
I don't walk very good at all.
Harold got COVID-19 this summer. He doesn't know if his case was tied to the fires, but he says the smoky air made it tougher to heal.
I had a real bad cough, and I would get some pretty strong headaches. You just continue to wear the mask, to try to not have the smoke affect you, because it does.
Food for Thought delivered food to him as he recovered.
I can't tell you how much it helped me. It was immeasurable.
Ron learned from years past how much these brown bags can mean. In 2017, power shutoffs during fire season destroyed nearly all their inventory.
And it's really painful to throw away that much food. We had an entire dumpster full of really great produce that we had to just throw away.
So they raised money for a generator and now are ready for the emergencies that will come.
Our clients really are more likely to have bigger problems than most people because they don't have the resources. Maybe they can't even afford the gas to evacuate.
But these families will have Ron and his team for support, tackling dual disasters, one tomato at a time.
It's a tough time for California.
For The Race, I'm Alexa Liaco.
More to come on The Race. Stick with us.